Imagine losing nearly 2 million brain cells every single minute. One moment you're speaking normally, the next your words don't make sense. Your arm won't move. One side of your face suddenly droops. Inside your brain, a silent emergency has begun. A blood vessel has become blocked, or it has burst. Oxygen stops flowing. Brain cells begin dying. And the most terrifying part? The brain itself cannot feel pain. You won't feel the neurons dying, but every second counts. Today, we're shrinking down, going inside the human brain to witness a stroke unfold, minute by minute, cell by cell. To understand the devastation of a stroke, we first have to appreciate the organ it attacks. Your brain makes up only about 2% of your body weight, yet it's incredibly demanding. It consumes a staggering 20% of your body's total oxygen and energy. Unlike our muscles, the brain has almost no way to store these vital resources. It depends entirely on a constant, uninterrupted blood supply. Every single heartbeat delivers a fresh wave of oxygen and nutrients through a delicate, branching network of arteries. These vessels are the lifelines for approximately 86 billion neurons. If that blood flow stops, for any reason, the countdown to damage begins immediately. This is the essence of a stroke, a sudden interruption of blood flow, and it happens in one of two ways. The vast majority of strokes, about 85%, are ischemic. Think of this as a plumbing problem, a clog. A blood clot forms or travels to the brain and gets lodged in an artery, blocking the path for blood. The remaining 15% are hemorrhagic strokes. This is more like a burst pipe. A blood vessel weakens and ruptures, causing blood to spill into or around the brain tissue. Blocked or broken, the end result is the same. Brain tissue is starved of oxygen, and within minutes, the cells begin to fail. Let's zoom in on an ischemic stroke, the more common type, to see what happens at the microscopic level. A clot wedges itself inside a cerebral artery. Instantly, blood flow downstream plummets. Within seconds, the neurons in the affected area are starved of oxygen. Their internal power plants, the mitochondria, can no longer produce enough energy, a molecule called ATP. Without ATP, the cell's entire infrastructure collapses. Tiny pumps on the neuron's surface, which work constantly to maintain a delicate balance of ions, suddenly stop working. The balance is thrown into chaos. Water rushes into the cells, causing them to swell up like water balloons. At the same time, a flood of calcium pours into the neuron. This surge of calcium is a toxic trigger. It activates destructive enzymes that begin to digest the cell from the inside out. The neuron starts to self-destruct. But the damage doesn't stop with a single cell. As these dying neurons fail, they release a massive, uncontrolled wave of a neurotransmitter called glutamate. In normal amounts, glutamate is essential for communication between brain cells, but in these toxic concentrations, it becomes an excitotoxin. It overexcites and poisons its neighbors. This glutamate flood forces open channels on nearby neurons, causing them to also flood with calcium. This sets off the same self-destruct sequence in them. The injury spreads outward like a wave, a cascade of falling dominoes, as one dying cell triggers the death of many others. The outward signs of this internal crisis, the symptoms of a stroke, depend entirely where in the brain this cascade is happening. Every region of the brain has a highly specialized job. If the stroke strikes the motor cortex, which controls movement, a person may suddenly be unable to lift an arm or a leg. If it hits the language centers, like Broca's or Wernicke's area, their speech might become slurred, nonsensical, or they might not be able to speak at all. A stroke in the visual cortex at the back of the brain can cause a sudden loss of vision. If it damages the cerebellum, which coordinates our movements, balance and coordination are thrown into disarray. This is why no two strokes are exactly alike. The location determines the symptoms, and this is why doctors have a mantra: time is brain. It's not just a saying, it's a biological reality. For every minute a major stroke goes untreated, the brain can lose up to 2 million neurons. The faster blood flow can be restored, the more brain tissue can be saved. For ischemic strokes, this means getting to a hospital quickly. Doctors may be able to administer a powerful clot-dissolving medication. In other cases, a procedure called a mechanical thrombectomy can be performed, where specialists guide a catheter through the arteries to physically pull the clot out. For hemorrhagic strokes, the approach is different, focusing on controlling the bleeding and reducing the dangerous pressure building up inside the skull. While the cellular fallout of a stroke is terrifying, the most encouraging news is that many strokes are preventable. A large number are linked to risk factors that we can influence through our choices and medical care. The single most important factor is controlling high blood pressure. It's the leading modifiable risk factor. Beyond that, it comes down to protecting your blood vessels and overall health. This means not smoking, as it damages arteries and promotes clots. It means staying physically active to keep your entire cardiovascular system healthy. It means eating a diet rich in fruits, vegetables, and whole grains, while limiting salt and processed foods. It's also crucial to manage underlying medical conditions. Keeping diabetes and high cholesterol in check protects the arteries that supply the brain. And for some, treating an irregular heartbeat called atrial fibrillation is critical, as it can cause clots to form in the heart that can then travel to the brain. But perhaps the most powerful tool for prevention and for limiting damage is knowledge. Knowing the warning signs is essential. The easiest way to remember them is with the acronym FAST. F is for face drooping. Does one side of the face droop or is it numb? A is for arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? S is for speech difficulty. Is their speech slurred? Are they unable to speak or hard to understand? And T is for time to call emergency services. If you see any of these signs, even if they seem to go away, call for help immediately. Never wait. So what happens during a stroke? It's a sudden, brutal crisis. A lifeline of blood is cut off, triggering a cascade of energy failure and cell death that spreads through the brain. The consequences depend on where it strikes and, most importantly, how quickly help arrives. While the science is complex, the message is simple. Many strokes can be prevented by managing your health. And when a stroke does happen, recognizing the signs and acting fast can save brain tissue, it can save function, and it can save a life. Because when it comes to your brain, every single second matters.